All right, it's all about living our best healthy selves. Good day. Once again, I'm Renee Nash, and welcome once again to Let's Talk Health. So today a conversation about an issue that many men, particularly men of color, do not like to discuss. We're going to be talking about prostate cancer and your prostate health. So joining me today for the conversation is Dr. Curtiland Deville. He is the clinical director of radiation oncology and the co-director of the prostate cancer multidisciplinary clinic here at Sibley Memorial Hospital. So thank you so much for joining us.
Thank you. Thanks for having me.
So what do we need to know about prostate cancer? Because one of the things that I think is very alarming, obviously, particularly in the Black and brown community, is that too many men are being diagnosed and too many men are dying of prostate cancer.
Yeah. Well, it's very important to raise the awareness. You know, as you say, Black men have higher rates of prostate cancer in the United States and really among the highest rates in the world.
Why is that?
We really don't quite know, the bottom line, why this happens. We know there are a lot of factors that are associated and probably contribute to this disparity, because that's what we're talking about, this healthcare disparity, why we have a higher incidence of prostate cancer in Black men compared to white men. And so there's probably some underlying biologic and genetic factors that contribute to that. But there's also things within the diet and the environment that probably also contribute to that, and why it is in the United States that we end up having among the highest rates of prostate cancer. Really important to touch on too, though, are access to care and those barriers to treatment. And what we do know is that when men receive quality health care, their outcomes are just as good as white men or their non-Black counterparts.
So let's talk about these risk factors, because we really want to get to that.
Yeah.
You said diet, and almost every conversation I have been having as we've been talking about Let's Talk Health, it's really been about eating well and exercising and all of these things, these two big issues for people of color.
Yeah.
We're not eating right and we're not exercising. And now, again, for men, this is the same issue when we're talking about prostate cancer.
It's true. It's really a challenge. We know that the American diet, the traditional American diet, which is high in red meat and saturated fat, has really contributed to the high rates of prostate cancer in men and breast cancer that we see in women. And so when we look at places in the world that have lower rates of prostate cancer, we've looked at what are the diets associated with that, and the Mediterranean diet comes up a lot. So this is a diet that has very little red meat and very little meat at all, a lot of fish, and also a lot of tomato-based products, tomato-based sauces. Tomato is actually a prostate-healthy food. Foods that have lycopene, like tomato and watermelon, are associated with lower rates of prostate cancer. And lastly, cruciferous vegetables, things like broccoli and kale. And I think, all of the things that I mentioned are not easy to access necessarily in communities that don't have healthy foods or even supermarkets within them. We talk about food deserts sometimes, places where people do not have good access to quality food that is really healthy for them. And so they may end up eating a lot of the processed foods or things that are just unhealthy and easy to access.
So let's talk about the prostate.
Yeah.
And particularly Black men. There seems to be so much stigma toward it. I have had a number of male friends and family members who have been diagnosed with prostate cancer. And the one thing that they always say is they don't want anybody to know about it. And so I want to say, why is that? But I kind of know why that is. But I want to hear it from the medical perspective.
There's a lot of stigma associated with the prostate in general and prostate cancer. I mean, one, it is a sensitive area that we're talking about. We're talking about the male reproductive organs and genital urinary system. And so it's already not an easy conversation to begin with, to get people to open up about that topic. And then things like the physical exam, which is, fairly, can be uncomfortable or a little bit invasive when we want to do our digital rectal exam. So the primary care doctor may ask the patient, the man, to sort of bend over so that he can feel and palpate the prostate. Well, that's important to see if there's any abnormalities, but people may feel very uncomfortable doing that. And so there's a stigma around just having a physical exam or taking that first step towards screening. And I think we've done a good job with women actually in reducing some of the stigma of these invasive tests with mammograms and pap smears. Those are kind of part of the everyday conversation and lexicon among women and their family members. And we've not done a good job for men with reducing that stigma and making it comfortable for men, particularly Black men, to have those conversations with each other. I mean, the fact is prostate cancer is very common among Black men. We were just talking about that. The lifetime incidence is 1 in 6 Black men. And for white men, that's actually, for their non-Hispanic white men, I should say, it's about 1 in 8. The other number that's important to know is that the death rate is twice as high for Black men. So 1 in 20, about 1 in 20 Black men will die of prostate cancer, and only about 1 in 40 non-Hispanic white men.
Wow.
And so it really ends up being a tremendous burden if we don't get men, particularly Black men, to the screening that they need and to the treatments that they need once they're diagnosed, if we don't address this stigma.
It's very similar when you talk about these numbers for Black women and breast cancer. And what I've learned over the years is that Black women have a higher death rate because we're being diagnosed later. And this is the case also for Black men. When we're talking about prostate cancer, they're being diagnosed too late.
Yeah, they tend to present or be diagnosed at a further stage, further along. And even when we look sort of stage for stage, the features of the prostate cancer for Black men tend to be higher or more aggressive. So the PSA might be higher. The amount of cancer detected within the prostate may be higher. And so there's certainly more disease burden that we detect in Black men.
What do you want to say particularly to Black men about this issue? Yeah. Because again, we said earlier, there's a stigma. And I don't know, because I'm not in the locker rooms, I'm not on the basketball or the football court, or in the playing golf with men. And whereas women, we will have candid conversations about our health, about what's going on with us, but men don't tend to have that conversation.
Yeah, I think it's really important for men to talk about prostate cancer, men that are diagnosed with cancer. I will ask patients, do you have any brothers? Do you have any sons? Have you talked to them? Because they're at higher risk. We know that first degree male relatives, so a father, brother, son, once one is diagnosed, the other is at higher risk for being diagnosed as well. And so it's important to have those conversations. Otherwise, you may not be aware that you need to be screened if you had a family member who was diagnosed with prostate cancer. And because it's so common, often when I ask men, have you talked about the prostate cancer with others, and they say, well, as soon as I told one friend, I started to realize all of these other folks had dealt with prostate cancer, or I knew people that were dealing with prostate cancer. And you can really build a network around that and receive support and encouragement. And as a physician, I can talk about prostate cancer and treatment and side effects and all of those sorts of issues, but it's really empowering to hear it from a patient or another Black man who has gone through those issues as well.
The emotional, the sexual side, that piece of the conversation, how do we get there?
That's the toughest part to deal with, truthfully. We're talking about, again, a very sensitive area. The prostate is involved or plays a role in fertility, and the treatments impact things like erections. And so these are already difficult conversations with normal aging process. And so adding cancer on top of that makes it even tougher. There's relationship dynamics that people might be considering. I really think open conversation is going to help that. Be truthful with your providers. I can only help if I know what the issues actually are that you're going through. And we have support services within the cancer center. We have social workers, we have counselors and therapists, people that can help us explore these other issues that occur beyond the immediate treatment facility or treatment center, right? If you don't see anything, we can't help. Of course, we should be asking the questions as well, so providers shouldn't be ignoring. It's kind of easy sometimes to ignore those issues. We shouldn't be ignoring them either, because ultimately that also impacts our other future patients. So some men are kind of afraid to even look into or get the PSA blood test for prostate cancer because they've already heard or know that it may impact their sexual function and their erectile function and those sorts of things. And so it may stop them from even entering the door.
When are there any, I guess, symptoms that men need to watch out for, or symptoms that their partners perhaps can alert them to? What do they need to know?
Yeah. Well, nowadays, actually, most of the time we diagnose prostate cancer before there's symptoms, which is a good thing. I always tell patients we want to get to the cancer before you're actually experiencing symptoms from that. And so through screening, which is basically taking a PSA test, PSA blood test, which is the prostate-specific antigen, but it's basically a marker in the blood. And usually that starts with a primary care doctor, who at the age of 50 is generally what's recommended. But sometimes for higher risk patients, say black men or those with a family history, they may advocate for starting and taking that blood test at age 45 or age 40 to establish a baseline. And that way they can follow it over time. So taking that blood test, doing the screening, hopefully you're catching the prostate cancer before the person is experiencing any symptoms. Unfortunately, we do still see some men who present with symptoms as well. And so generally, if they're having symptoms from the prostate cancer within the prostate gland, it's causing probably trouble with urination. And so as the cancer grows around the urethra, that's the tube that drains the bladder of the urine, runs right through the prostate, they may start to experience trouble with emptying their bladder, urinating very frequently, getting up at nighttime a few more times than they're used to. Those can be sort of subtle early signs, or really just trouble peeing. The guy says, I'm trying to pee and it's not coming out. And really that becomes an emergency and they need to get to their urologist or get to the emergency room to help get that managed. But those are some of the early signs. Some of the later signs, if someone actually presents with cancer spread beyond the prostate, this is another important warning sign, is they may have focal areas of pain within the bone. So they're starting to have bone pain. Prostate cancer, unfortunately, if it does spread, likes to spread to the bone. And so they may have a spot that's different from other types of pain that they had, and it's persisting, it's not going away, you press on it, and it's really painful and uncomfortable. That can be a sign of what we call metastatic prostate cancer, cancer that has spread to the bone.
What is the typical treatment for prostate cancer? Is it standard radiation, is chemotherapy, or it ranges? And how far are we to a point where we can make prostate cancer a thing of the past?
Well, I wish we were closer to making it a thing of the past, just because it is so common, most common cancer, non-skin cancer in men. But we have made a lot of progress with improving the outcomes and really improving the cure rates and the survival for prostate cancer. And so really it depends on what we call the stage. So how early are we diagnosing the prostate cancer? If we discover the prostate cancer where it's still contained within the prostate gland, we generally think of it as being curable. We can eliminate the cancer. And the two treatment options there are basically going to be either surgery or radiation. So I tell patients you can take the surgery road or you can take the radiation road. And one treatment is not better than the other. Really, this is where something like a multidisciplinary clinic can play a good role. Once the patient has a diagnosis, it's great if they can go to a prostate cancer multidisciplinary clinic. Most academic centers have those. And I think of it as kind of a one-stop shop for really examining your diagnosis, the workup that you've had, whether any additional workup is needed. You have all of the providers in the room at the same time looking at your individual case and then making a recommendation to you at the very end about what your best treatment options are. And so that can also help when the surgeon and the radiation oncologist are in the same room and can speak to this individual in front of them what might be their best surgical option or radiation option. Or maybe they just have both options at the end of the day. And it's for them, we do what we call shared decision making, right? So within their value system, we're going to help figure out, for you, Mr. Jones, what's the best treatment for you? A lot of patients will ask me, what would you do if you were in this scenario? What would you do for your father? And I like to say, well, what my father would do is very different than what my uncle would do. They're two very different guys, and one may value one type of treatment, and the other may say, hey, I can deal with that type of treatment. I want to get this other treatment. And so it's important for us to have that conversation with the patient to get a better understanding of that.
Here in the District of Columbia, again, there is a high incidence of Black men with prostate cancer. And as you said, it's a combination of things, with the food, the diet, family dynamic. But there's still that fear among men who don't want to face what's perhaps going on with their bodies. Talk about the role that women can play, because a lot of times you can't even get a guy to go to the doctor, right? It's usually some woman, the mother, the wife, the girlfriend, the sister, kind of pushing them down the road to get there. What kind of role do we as women play?
It's very true, and it's very important. Sometimes I'll speak at a breast cancer event about prostate cancer because I know there I'll have an audience of women who have male partners, have their husbands, their brother, their uncle, their cousin, their father, you know, whoever it is, that they'll be able to bring this information to if I couldn't get those men into the room to hear that conversation about prostate cancer. And that's really important. You know, I think, you know, checking in on our loved ones and really, you know, encouraging them really to just start with a checkup. You know, are you having an annual physical? And when you do that, you know, what is happening at that visit? You know, did you have a conversation around prostate cancer? Did you talk about colorectal screening? You know, a lot of this is age-based, but for, you know, as we get older, and particularly over age 50, all of these are routine conversations that should be had with a primary care doctor. And I think it's really important also for Black men in particular. There was a little bit of debate and controversy around screening for prostate cancer a few years ago. There was a national guideline that was issued around 2011, 2012 that didn't advise for routine screening for all men, sort of what we call normal risk men. And there was a sort of a debate because Black men had higher risk, had higher incidence, as we've been talking about, and actually higher death rate. And what happened is, unfortunately, a lot of men were not having those conversations anymore with their primary care physicians around screening because they had heard, oh, I think I don't need to be screened for prostate cancer anymore. And so it's very important that even when you're having a physical exam, you can't just assume that screening for prostate cancer is happening. And so I would encourage all Black men and their wives, spouses, partners, daughters, you know, whoever's involved or interacting and helping them should be asking those questions because, again, your best outcomes are when you're diagnosed early. And so women can play a great role in doing that.
So again, for most men, the age is 50 to begin testing. But for those who may be at a higher risk, meaning they have a history of it, that should be at the age of 45.
At age 45, yes. And again, some urologists will even advocate for setting a baseline PSA at age 40. If you have a strong family history or multiple risk factors, again, African American men or Black men are at higher risk as well. And that way you can monitor that PSA value over time and see, is it changing, how is it increasing, and not necessarily waiting too long and then just having sort of one single arbitrary value that you're trying to make a judgment on. So it's good to start early and kind of monitor that over time.
And again, it's about having the conversations with your family members. One of the things that I know that often doesn't happen, it's not the conversation you're having around the dinner table at 6 o'clock, if you're even sitting around the dinner table anymore, is knowing that family history. Many of us don't know the family history. We don't know that our grandfather had prostate cancer and our uncle had prostate cancer and maybe even your dad had prostate cancer. You don't know that.
It's so important. I mean, can't emphasize that enough. I talk to patients all the time who say that they don't know the history, or if they mention to a family member that they were diagnosed with prostate cancer, they may have someone say, oh, I think your father had prostate problems as well. So there's kind of this vague information that's been passed down. And then unfortunately, the son that needed to know that information didn't know and then wasn't having his PSA checked and he wasn't being screened. And unfortunately, it was being detected and diagnosed too late. So really opening up those conversations in families and reducing some of that stigma around talking about prostate cancer specifically is necessary and important.
Dr. Deville, thank you so much for joining us. Anything else you want to add about prostate cancer that, again, we want everybody to know what they need to do to protect themselves?
I would really encourage patients to be screened, particularly Black men, to be screened for prostate cancer. Have that conversation with your primary care physician about the risks and benefits of pursuing the blood tests and doing the digital exam to check the prostate. If you're uncomfortable with doing that, they can still check the blood test. So don't let that discourage you from going into that exam. And if you're diagnosed, definitely seek out a second opinion. You know, no physician should have an issue with you seeking out a second opinion. Make sure you feel comfortable with your diagnosis and your physicians and the treatments that they recommend. I tell my family members that all the time. If you're uncomfortable with your doctor, you should find another doctor then, because you should be able to have these conversations and be truthful with your physician. Tell them, I ask my patients at the end of our visit, so what do you think you're actually going to do, or what are you going to implement? Because if you're going to do something different, you know, this is not going to work out well. So, you know, as much as you can tell me, I can work within your value system and figure out the best options for you specifically.
All right, Dr. Deville, thank you so much
Thank
for
you.
joining us today for Let's Talk Health. Once again, that is Dr. Curtiland Deville. He is the Clinical Director of Radiation Oncology and the Co-Director of the Prostate Cancer Multidisciplinary Clinic here at Sibley Memorial Hospital. Once again, I'm Renee Nash. This has been Let's Talk Health. Again, make sure you continue to connect with us as we seek to engage you and inform you about living your best life. And in order to do that, we've got to be healthy. Thanks so much. Be well.